of your nutritional needs. And today with us, we have our speaker and our guest, Dr. Parul Vadgama. Before we go ahead with the webinar, I'll just give you a very brief introduction. Dr. Parul Vadgama is the head of the chest department at Civil Hospital, Surat. She has also been the vice president of Indian Medical Association, Gujarat, and the chairman of the Public Health Committee, Gujarat Chamber of Commerce. She has a keen interest in management, communication, relationship building, and networking. Her go-to motto is that nothing is impossible with hard work, dedication, and commitment. So now that we've already taken up so much of your time, without further ado, I'll be handing over to Dr. Parul now.
Thank you, dear, and thank you, Ruman, and of course, Shivam, for giving me this opportunity to talk on this important day for all of us, which is World Health Day. And just for your, knowledge, that this World Health Day is observed since 75 years. 75 years when WHO decided, World Health Organization decided that we should definitely care for the health of, not only the affluent people and affording people, but also of all the citizens across the globe. So this was observed. This was started observing that every citizen, whether he is poor or he is affording, whether he is in rural area, whether or in city area, everybody should get good health. And nowadays there is a concept of concept for preventive health, means treating a disease after getting a disease is a different concept, and that is known as therapeutic health. But avoiding a disease by improving your lifestyle, improving the causal factors, is again a different type of treatment, which is known as preventive therapy. So now the world is going towards the preventive therapy. We don't want only therapeutic treatment, but we want the avoid and decrease in the incidence of all the diseases. And that is why this year the theme of this World Health Day is health for all. So health for all basically is the theme, and which we all youngsters and all students, all citizens should take it up. So let us discuss one by one. I will try to put up my presentation. Just give me 1 minute. Yeah. Can you all see the presentation? Can you listen me?
We can hear you, ma'am, but we can't see anything yet.
Okay, you can't see?
Yeah.
Just give me 1 minute.
Sure.
Share karo, share screen. Now, can you see?
Yes, ma'am, we can.
Okay. So you can see the slides also, no?
Yes.
Okay. Next camera. So let us go towards the discussion of nutrition and diet, which is a very, very important aspect of our life. Over the years, we have realized that, our aged people used to tell that you should eat this, you should not eat this. So there is always an importance of the intake what is the quality of the intake, what is the amount of the intake, and what is the portion of the intake which we are taking inside. See, basically what we have lost means most of the disorders nowadays are lifestyle disorders. So basically lifestyle disorders are those which are related to high calorie intake, especially high carbohydrate intakes, and less protein intake, and of course less amount of minerals and vitamins in our food. So when we want to balance our diet, we have to think about the portion, right portion of carbohydrates, proteins, minerals, and vitamins, and of course the right portion and right available means freshness of the fruit. Especially when we talk nutrition, we have to have the combination like energy, which we know that it is through mainly through carbohydrates and fats, and the right amount of protein gives tissue regeneration. It gives us good immunity. So protein is also one important component of our diet. Basically balanced diet is one which we all know actually, but sometimes we don't implement in our lifestyle. So it is mainly about getting the proteins, carbohydrates, fats also. So don't think that the fat is not important and you don't consume oil or ghee at all is good for your health. No, it is necessary. It is necessary for tissues. It is necessary for your mental IQ level. When you don't take sugar, carbohydrates and sugars and fats, that time your mental your brain needs that material to work. So that is also very important. Vitamins, mineral, and of course the right portion of water. You must be knowing that in our body 80 to 90% is water. So water intake is very important, and at least normal person should take 2 to 2.5 liters, but in summers they should take 3 to 4 liters of water. And especially when there is a normal person, they should take, in cases of kidney disease and maybe liver diseases, we restrict water also, we restrict salt also. But for a normal person in summer season, you should have at least 3 to 4 liters of water intake. And fiber, we all know fiber we are getting from salad, especially cabbage, carrots, cucumbers, and of course we are getting from some cereals which is coarsely grinded flour of wheat. So all these things which give us fiber are also very important to avoid the constipation and to have a regular flow of your stool. So that is very important to have all these items in our portion, right? So we know that we require energies. The calorific values of different nutrients in our body are, like for example, calorific value means if we consume the same amount of carbohydrate, lipids, and proteins. So if carbohydrate give us 4 kilocalorie per gram, lipids means oils, fats, these are all called lipids. Lipids give us oil, ghee, some sort of different types of ghee. These all give us 9 kilocalorie per gram. Proteins give us 4 kilocalorie per gram. So if we take 1 gram, then we get so this much of calorie. This is known as the calorific value of different nutrients in the body. So actually what we see, what we are spending throughout the day, for example, energy expenditure of a person, we many times say that we do this, we do walking, we do this much of exercise, but the right calorie calculation actually is done by calorimetry. I'm not going to discuss in detail, but yes, this is a method which is available, which is known as direct calorimetry and indirect calorimetry. In this direct calorimetry, a subject is insulated chamber surrounded by water. See, this I'm telling you because these are the exact ways of calculating a calorie output, means the utilization of the calorie from your body, which can be calculated by this method. Just to for your knowledge, I am mentioning the name, otherwise it is not very important and you are not going to do it. Now let us talk about some proteins. Actually, proteins are amino acids. and they are different in their calorie, giving their calories. There are different in their formulas, of course. And we all know that we get proteins from, groundnuts. Then you get from this cheese, paneer. You have to have milk with a protein shake. And then you have other things like chana dals, then shing. All these, you can advise your mother or your cook to prepare laddus of groundnut and chana, and all these things can be mixed. And of course, a good protein can be from non-vegetarian food, especially the fish, and all these things give you a good amount of proteins. And of course, you can get it from the eggs. If you eat the eggs, then that is also very important. And I advise that those who are eating eggs and non-vegetarian food, they should definitely consume at least 250 grams of non-vegetarian to 300 gram of non-vegetarian food every day, or 2 to 3 eggs, at least 2 eggs per day, so that your protein intake is good. You can get it also from the other dals like chana dal, moong dal, all type of dals, means all type of grams, Bengal grams, other type of grams can give you a good intake of protein. So this is about protein. And at least you should take, to be very frank, you should take 1 katori of dal, and 2 eggs in the morning, 1 katori of dal in the afternoon. You should take one piece of paneer or cheese in the evening. And definitely you should take some groundnuts or chana sort of things with the good in the evening, if you are not taking some snacks in the evening. So all these things will increase your protein intake and definitely give you a good tissue generation, which is very important, specifically after COVID. What is happening after COVID, that many of our patients have the issues related to muscles, related to skins, related to regeneration of the skin, the hair issues, the regeneration of the lung tissues. Many are having fibrosis. So in such cases specifically, we advise that they should take high protein diet, which will definitely help in increasing and boosting their immunity, and definitely increasing the regeneration of tissues, which is very important for our uh, growth. Of course, if a person is less than 12 years, they are growing people, they are growing persons, so they need more protein and carbohydrates as compared to the people who are after age of 40. So calorie requirements after 40 years, it also decreases. It is known that BMR, basal metabolic rate, is actually higher in males than females. Younger persons, it is higher. Colder climate also, this is higher. We know that many a times we feel more hungry and more try to eat more in the colder climates, because our BMR is higher. And non-vegetarians also have the higher BMR. This is a study which is published, and these are the findings I have taken from the study. In fact, BMR means there is more requirement of the food and more energy is burnt out in a case of pregnancy, hyperthyroid people, fever, severe anemia, and polycythemia also. BMR also increases when there is starvation, hypothyroidism, and adrenal insufficiency. Means hypothyroidism means a condition where the thyroid hormones are less. In that case also your BMR is decreased. Starvation also BMR is decreased. Means agar up continuous, if you are not taking the food and you are completely starving your body, you will not lose the weight. Why you will not lose the weight? Because your BMR will be decreased at time. So BMR has to be maintained by eating small meals at small intervals. The BMR has to be increased rather than decreasing it by doing the starvation. So BMR is decreased in cases of starvation, hypothyroidism, and adrenal gland insufficiency. Adrenal is a gland which is present over the kidney, above the kidney. So in that condition, if there are hormones which are released in lesser amount, then there is adrenal insufficiency, and in such case the BMR can be decreased. So proteins have the highest level of proteins give us tissue regeneration also, and the energy also. But at the same time, physical activity is also very, very important. We have to talk about the energy expenditure. We have to talk about the physical activity. Occupation, mainly there are three types of occupation: sedentary, moderate work, and heavy work. So most of the people nowadays are doing office work, or they are shopkeepers or housewife. These are different types of profession where we have seen that people working in the office are so sedentary, whereas plumbers, electricians, tailors, postmen, these are called moderate workers. And at the same time, as compared to that, these farmers, blacksmith, factory workers, miners, rickshaw pullers, these are called heavy workers. So we have to energy expenditure of a man during sedentary work is 110 kilocalorie per hour, whereas during moderate work is 150, and during severe work is heavy work is 20 calories. So a person has to define the calories according to that. So this is the calculation between men and women, where you are, what type of work you are doing and what type of energy you are spending throughout the day. According to that, your requirement will be decided. So energy requirement of the person will depend on BMR, type of occupation, the hours spent in sleep. That is also very important. Those people who are not taking good sleep, their BMR is not high. They are putting on the weight. So sleep disorders or taking less sleep results in increasing the weight gain. So that is also important. And requirement for Indians have been laid down by this ICMR. ICMR means Indian Council of Medical Research. So in that they have taken the reference whether the person is in which age group, whether he is male or female, whether what is the type of occupation. So Indian reference man spends 8 hours in sleep, 8 hours in occupation, 6 hours in sitting, reading, writing, and 2 hours in household work or recreational exercise. So this is how they have calculated. So calculation of a person when he is sleeping 8 hours, that is 65 kilocalorie per hour, means 520 calories energy requirement of the man engaged in this sedentary occupation. So 520 kilocalories uh, uh, per hour means for throughout the night he is spending sitting. If he's sitting, standing, occupation, all this is the expenditure. So we can see that for a person, for a man who is engaged in sedentary lifestyle, 2220 calories he is spending, right? And about that we calculate 10%, so grand total is 2442. That is round off is 2400 calories required for a person who is having sedentary lifestyle and doing a middle level of occupation and who is a male. Similarly, these if you want my presentation is bit scientific, but because you all know what food gives what, but this scientific presentation I have brought to give you exact calculation, to know it, to give you the concepts. And don't think that if you starve you will lose weight, if you don't take sleep you will gain weight. That is also a fact. So all these are the requirements. I'll share the presentation also if you require. But overall, these are the calculations of the queries which are required in moderate occupational work, and it is rounded by 2200. And engage in heavy occupational work, people need 3000 calories. So ICMR, which is a body, supreme body of our medical field, has recommended energy allowances for Indian males and females of different weight group. These are the calories divided and recommended energy allowance, right? So overall, what we have realized, I think this is not a present. Please give me that presentation. So from this presentation, we have learned that the mainly requirement of the body is carbohydrates, proteins, fats, minerals, and in minerals we have to specify about the zinc. We have to take the calcium, especially after the age of 40 years. We should start taking the calcium, and we should also start taking vitamin D3. Many patients we have seen who have lack of iron. So iron deficiency anemia is also very common. Iron is basically measured when we measure the hemoglobin. So in many females, we have seen that hemoglobin is less than 10 gram. So less than 10 gram in Indian females, it is very bad. So we have seen that 40% of our females are having less hemoglobin, lack of hemoglobin, which is known as anemia. So in that cases, we have to treat anemia with iron-rich fruits like green vegetables, salads, palak, and all khajur, means dates, and green vegetables. And you should give good jaggery in good form, in a good amount, so that the hemoglobin can be increased and patient is out of the anemia. Similarly, is a common of uh, vitamin B deficiency, vitamin B12 deficiency. Many times people are having, body ache, they are having weakness, they are having giddiness, they are having, weakness in the feet, burning sensation in their hands or body. So that is also important, that we should have correct the vitamin B12 deficiency with injectables and tablets. So these are some common things which I wanted to share. I think if we have questions, we can take it up. According to questions, I will answer the questions regarding the nutrition. Thank you.
Thank you so much for the presentation, ma'am. During the meeting itself, a few people had dropped in their questions in the chat box.
Okay.
I don't know if you are able to view it.
I will try to view it. I will try.
Okay. You just need to open the chat.
Yeah. I'm a chat open. Chat. Okay. What the question is eating chicken 4 to 5 times a week is fine, considering that I work out 3 to 4 times a week and need to make up for my protein intake? Yes, it's absolutely fine, unless and until you don't consume much. Like I would suggest 250 to 300 grams of non-vegetarian food you can take. Adult person above 18 years should take, and if they have the workout 3 to 4 times a week, it is absolutely fine. But at the same time, with protein, you have to be careful that it should be hygienic, because we are nowadays finding many non-vegetarian food related worm infestation in the patients, and they are coming out of the they are coming to us with the allergy and sort of lung infections also. So non-vegetarian food, it should be properly cooked, it should be properly hygienic, and it should be well prepared. So you can definitely take 3 to 4 times a week, and the amount should be 250 to 300 gram. The second question is uh, L-carnitine and L-arginine safe to consume? It is safe, but it is actually not needed in all patients. It is only needed who are facing the weakness, maybe especially post-COVID weakness, or post-COVID neuropathy, or post-COVID myopathy. Muscle-related and neural weakness they can take, but otherwise L-carnitine is not recommended in all patients. Okay, next question is honey, lemon, and warm water. Yes, I have good data to show that warm water is helpful in reducing weight, definitely. Honey is not a proven case. For honey, we don't have any proof. But yes, lemon will help you in maintaining your vitamin C, which we didn't discuss. Vitamin C, especially we get from lemon, we get from all sort type of items, especially mosami, oranges, mosamis, and all these things. You can have a good amount of at least one fruit of orange and mosami every day, so that your vitamin C is good and your skin is better, and skin should be healthy. And your respiratory epithelium means your lung wall also get a layer from the vitamin C. See, try to understand that vitamin C will not only give you a good skin, but it will also give you a good lung layer, which protects you from all the infections. So I would suggest that hot water and lemon is wonderful, and you should take it not only to reduce weight, but you should take it on routine basis, so that your skin and the layer of epithelial layer of the lung is maintained, so that immunity is sustained and there is no breach in the immunity, so the virus doesn't go into your lungs. So that is required routinely. Okay, now next question is, which vitamin brand will you promote which makes up for all vitamins and minerals with the omega-3? See, this is, I cannot suggest a brand in my talks, but if you contact me personally, I will definitely tell you. You should take a combination of the vitamins, especially it should have B1, B6, B12 vitamin. It should have the zinc, and it should have the omega-3 fatty acids. So a combination should be taken, because you cannot take different tablets for all. But for vitamin B12, it is preferred that you take injections, because B12 is a fat soluble vitamin, and if you take the injections, it will have more effect and faster effect rather than B6 or B1 or B12 or B1 or B6. So B12 should be injection. B12 vegetarian food, there is no source except for milk, but egg is very good source of B12. Non-vegetarian food is the highest source of B12, and of course eggs and fishes are also good in B12, but egg is not very rich. So again, for B12, you have to take non-vegetarian food. Milk you can consider in B12, but you have to take large quantity, at least 2 glasses of milk a day. But still, many patients are finding, we are finding B12 deficiency who are taking only milk. So non-vegetarian food is best for B12. And if you don't take non-vegetarian, you can supplement yourself with the B12 injections or tablets. First, for corrective measures, you can take injections, then you can take the tablets. Nowadays sublingual tablets are also available, which are easy in taste also, they are good. Okay, so you can have the multivitamin tablet without a doctor to contact, but I think for the first time you should definitely contact a doctor, because the basic reports like hemoglobin, your multivitamins levels, your CBC will decide whether you have anemia, whether you have B12 deficiency, whether you have B1 deficiency, or you have other deficiencies. So one time at least you should contact the doctor, otherwise that is issue. Okay. Any suggestion on vegetarian food for pre and post morning workout? Yeah. I would suggest that in the morning you should take definitely some juices, and that is better, because before workout, if you take heavy, then it is not fine. But post morning workouts, you should take some sprouted grains. You should take some bread or one small chapati. You can take green vegetables, and sprouted is must. Eggs, 2 eggs are must. If you are not eating eggs, then you take one glass of milk along with sprouted grains, and one small chapati or poha or upma. That is enough for a vegetarian diet. Before exercise, you take only liquid, and that is also not to be taken in a lot of amount. It has to be very small quantity, otherwise it's difficult to do the workout. Immune system, I would suggest 4 things. You should first thing, what we are doing nowadays, we are chatting late night, we are doing internet late night, and we all are not sleeping till 1 o'clock, 2 o'clock. We are celebrating birthdays. So first of all, ensure your sleep for 8 hours. Minimum 8 hours are required. Second thing which we have to avoid fast food. Take a good breakfast with you in your colleges, with your friends. You should have one sprouted, one chapati, one fruit, one small quantity of dry fruit, and one glass of milk, one glass of at least one curd, 1 cup of curd in the evening. And you should also have, in this summer season, you should have buttermilk. You should have more and more liquids to take with salt. Take buttermilk with salt so that it gives you a lot of energy. Salt depletion is also one of the cause of weakness in this season. Some patients are having sudden lapse of weakness and giddiness, that you have to take care with your checking of blood pressure. Blood pressure, if it is normal, then fine. If it is less, you have to supplement with the ORS solution. You have to supplement with liquids, lemon juice. Buttermilk is best because it gives you lactobacillus as well as salt with it, and it gives you water into your body. So buttermilk you should definitely utilize. Panna, make a drink of which you can make easily at your home. That also you should take in one bottle with you. You should take some lemon juice and valyali sharbat also with you, especially when you are going outside in these days. Milk, okay, some patients can have milk allergy and they can have pimples because of that. So you need to show to a pediatrician. But then if you are not having good thing with the milk, you can eat curd, or you can eat buttermilk, so that your milk compensation is done. But if you are not taking milk, you take other like sprouted grains. All types of dals have good resource of protein. Or if you like cheese and paneer, please eat paneer thrice a week. That is very good source of protein. You can, it's not necessary to make paneer sabji, but you can eat paneer in any form. And at least 100 gram of paneer 3 times a week you should take. One cheese cube, 1 or 2 cheese cube you can take once or twice a week. And then you should take at least 1 cup of curd, at this much of curd, 1 bowl of curd every day in your meal, maybe evening or afternoon. You should bring one big bowl of salads every day to have your regeneration of the cells. Then you should take at least 1 or 2 chapatis in the afternoon, and especially millets, means bajri ka rotla or jowar rotla in the evening. So balance your diets. Don't take rice if you're taking chapatis. Take either you eat chapati or rice. Don't take it simultaneously in the afternoon. Take your bowl of salad, a big bowl of green vegetables, a big bowl of dals, and then one chapati with small rice or 2 chapatis with rice. And in the evening, you should take specially bajri ka rotla or jowar rotla so that your composition of the millets is also done. So all this is about your type of chart. But paneer has very less amount of fat. If you prepare it in the oil or in the ghee, then it will have fat. Otherwise, paneer is richest source of protein. So don't use additional oil or additional ghee to make paneer sabji. Yes, dry fruits are very good. If you are taking good number of dry fruits, you can avoid multivitamins definitely. In fact, all seasonal fruits are also very good. Seasonal fruits are helping you to improve your immune system. Yeah, kids, you have to take care. In kids, you have to establish a practice of dry fruits, a practice of fruits, a practice of salads, practice for dal, practice for green vegetables. All this is you have to cultivate in your students, in your kids especially. You can make paneer parathas for them, which I also do for my child. So paneer parathas, they like it also and they eat it also. You should give them curd, you should give them milk, you should give them eggs if they are eating. You should give them buttermilk. Then you should give them dals, mixed dals with ghee. Ghee is very much required in the age up to 40-45, because that is a formation year of our body. So ghee or oil is required in certain amount. You should take at least 10 to 20 ml, 10 to 15 ml of ghee or oil throughout the day. One small amount in sabji, small amount in dal. So small amount means, I mean half teaspoon for one portion. So half teaspoon for your kid, some ghee or oil you can use for their particular one time meal. So it is important to give oil or ghee to the children, especially the growing children. So whey protein is safe. Definitely, you should consume it. If you like it, definitely you can. Uh, it's good to have dry fruits daily. Definitely, we should take it. What is best food for Q10 coenzyme? Actually, it is not specified, but Q10 enzyme you can take or you cannot take. There is no certain guidelines, but overall, you should take a multi type of food which should contain your carbohydrates in terms of your chapatis. It should take green leafy vegetables like palak, methi, tandarja bhaji, or any type of bhaji at least once a day. Once a day means either in afternoon or evening. You should take 2 eggs a day, especially in morning. You should avoid breads, especially the refined breads. You should take at least one bowl of pulses in the afternoon or in the morning time. If you are not consuming eggs, you can take the one or 1.5 bowl of pulses along with milk or tea or coffee. Then you should take in the evening, you should take millets, rotlas. You should take some vegetables, green vegetables in the evening. And then you should take milk or milk products. You should take dry fruits. You should take 5 p.m. evening. You should take freshly cut seasonal fruits, which will give you best immunity. And of course, dry fruits you should take in the morning with the breakfast. When you're taking breakfast, you should have 3 to 4 almonds, 2 to 3 kajus, and you should can have other dry fruits, but at least almonds and kajus you should take. Anjeer also, it is very rich source of calcium, so you can take anjeers also, which is very good. And other things also you can take according to your taste, but you should have the fruit or fruit juices in your diet at 5 p.m. So all this is what I have told you, the basic requirement of our body, of an adult body. But according to the person, it may change according to the severity of your exercise. It can change. And which type of eggs are good? Normal white, yeah, normal white eggs are good, or omega 3, oh, no, normal white eggs are good enough food. It's there is no special recommendation for omega 3 cream colored ones. Normal are good. You should take 2 eggs per day. That is a protein requirement. Suffice your protein requirement. Along with that, take in afternoon you take 1 cup of dal, 1 katori of dal. That is important. It should be thick dal. It should be not be very much boiled. Too much boiling of the dal causes denaturation of the protein, so it should not be too much boiled. It should be thick dal. It should be supplemented with half spoon of ghee, which will definitely give you a good nutrition. Okay, I will, yeah, I will share the diet chart with Shivam. Actually, I couldn't show you in this my presentation, but I will put a screenshot and I will share it to Mr. Shivam, and he will definitely share on. Can you share it, Shivam? If I give you on WhatsApp or mail?
Yes, ma'am. If you share
Yeah,
it with
thank
him,
you.
I'll take it and
Sanka,
share it with him.
yeah, Sankhya, you share. I will share with you
Sure.
also, and please share it. Share that diet chart with him, with all people. We can
Yes.
do that. Okay. So, any other questions, Sankhya?
No, ma'am. I think you've answered all the questions for today. Thank you so much for
All right.
providing us
I
with
I
such an
am
amazing
actually I am
presentation.
actually sorry. I was in one operation and I was late to join. I was rushing to my presentation. So being doctors, sometimes we can't we don't know when the patient will come and when the
Yeah.
emergency will come. So I apologize my audience also for being somewhat late. But if any queries are there, you can definitely message to Sankhya and she can ask me on WhatsApp. We will be definitely answering all the things to you. And I will provide the diet chart immediately after 10 minutes. Okay.
Yeah. Thank you so much, ma'am, for sharing your learnings with us. And thank you, everyone, for being a patient audience. If you have any other questions, please feel free to reach out to your host and we'll transfer it to Dr. Parul. And thank you so much for joining us today. See you very soon. Thank you, ma'am.
Thank you, dear. Thank you.